Can you tell us what PHAC's assessment of the chances of a seventh wave of COVID are in the fall?
Thank you for the questions, Mr. Chair. I think the pandemic is not over, and I think given the continuous evolution of the SARS-CoV-2 virus, we think that it's very likely that we will get some more viral activity in the future. And we can't predict exactly how big the next wave is, but I think we need to prepare. We need to prepare for the fall and winter season.
Thank you. What is the current thinking of what the next virus will look like in terms of the mutation?
It's very important that we continue to monitor the genomics, so genomic sequencing, and which is being done right now. The Omicron virus continues to undergo evolution. You've probably seen the various sublineages, and in particular, right now we're monitoring 3, BA 2.12.1, BA 4, BA 5, that has some immune escape properties as well as increased transmissibility. Those variants could potentially cause an increase in activity. But even more importantly, we're watching out for some very different variants that may, just like Omicron when it first started, may have come from an immunocompromised host or even from animal sources. Those are even more concerning. And as yet, we can't predict that. That's actually can happen by chance.
Thank you. Dr. Tam, what's the current thinking in terms of whether there's a significant difference in the ability to transmit COVID-19 between a vaccinated and unvaccinated person in Canada? And I'm thinking in terms of the Omicron variant that's prevalent right now.
Just thank you for that question. And I think Omicron was a game changer, is a game changer. Prior to that, 2 doses of vaccine, for example, had a very high efficacy against infection and therefore transmission, as well as severe outcomes. When Omicron came along, 2 doses really waned over time in terms of protection and had a really decline over time to 20% or less after 6 months in terms of protection against Omicron. So it is an immune evasive variant, but 3 dose does give you a boost back up to 60% on average for protection against infection.
Is it your view as Canada's Chief Medical Officer that there's a medical or health basis to the vaccine mandate on federal transportation like airlines? Is that still valid at this point?
Well, I think when the mandates were implemented, there was a strong resurgence of the Delta variant and the vaccines were very effective, even though there was beginnings of some waning immunity. So even 2 doses, very effective against infection and, of course, serious outcomes. Omicron is a game changer in that you really need to increase the number of doses of vaccine. 3 doses will boost your immunity against infection and definitely for serious outcome. So these things need to be considered. And given the reduced vaccine effectiveness, even with 3 doses, against the Omicron variant, vaccines cannot prevent all transmissions alone. So a layered approach has to be considered, including layering mask wearing, for instance. But these are the things that the relevant ministers need to consider.
Thank you.